Hi everybody, I'm Amy with Weber Morgan Health Department.
And I'm Jesse as well with the Health Department.
We wanted to come talk to you today a little bit about the reasoning behind and the appropriate ways to do some of our social distancing recommendations. The two things that we are going to discuss today is the recommendation for staying 6 feet apart, why that's important, and then we're also going to talk about appropriate mask how to wear your mask appropriately and why that's important. We have our handy dandy bottle of spray here to help us to kind of show maybe a better visual representation of why these things are important. It's going to represent the spray of droplets that can potentially come out of our mouths when we are speaking, sneezing, so forth. It is pledge, so we will both be very clean by the time we are done with this. So the first thing we want to talk about is social distancing. Temporarily, we're going to sit close together to be working. You can see if Jesse and I are working together and we don't have a good 2 or 6 feet between us, but say only 1 foot or 2 foot between us, you can see that if while we're talking to each other or we happen to cough or sneeze and that wouldn't be covered, we could easily, oh, Jesse, gross. Well, my phone is covered in spray. I am covered in spray.
Well, even when we normally talk, right?
Yes.
Sometimes exactly. If I breathe harder and I'm really excited and I'm talking about a story and I just starts coming out.
Yeah.
Or just normally.
And then we have shared those germs. Now, if we can put 6 feet between us, then as we are talking, and we apologize, it kind of is hard for our camera to capture, as we are talking, if by chance one of us happens to get excited or to cough or sneeze, or even that general spray as we're talking, I am not feeling that spray coming through. I am at a safe distance to not be in that direct airspace of the droplets coming out of Jesse's mouth, and vice versa. We have that protection. We've had a few questions as to people say, why 6 feet? Where does that number come from? I'm going to say that is a general number that we have found as we have looked at a variety of infectious diseases that are spread by respiratory droplets. As we know, COVID-19 is spread primarily by respiratory droplets from person to person, and so you can say that that's a little bit of a larger droplet spread, and that's when I'm talking or speaking or those droplets come out of my mouth, that's kind of the range is up to 6 feet. Or 2 or 3 meters that those droplets can travel before they would fall to a surface or fall to the ground. So that answers our question for 6 feet. We have that appropriate distance to not share germs. Now we're going to talk a little bit about face masks as well. So the recommendation from the governor's office and from public health is that especially when you are in public, that we would strongly recommend you wear a face mask, whether that be a fabric mask or a basic surgical mask that you would have available to you. In general, the face mask is most protective for the person who would potentially be infectious. So if Jesse was sick and having symptoms or even no symptoms, because we can have asymptomatic cases of COVID on occasion, then he wearing that face mask would stop any of that spray or those droplets coming out of his mouth. That's kind of hard to do, but as he would talk to me, those droplets are physically stopped and captured within that face mask.
Question, Amy. Does a cloth face mask stop all the droplets?
So, good question. A cloth face mask may not stop all the droplets, but it's going to stop the large droplets. So it may not capture 100%, but it's going to capture the majority of our risk of infectiousness. So, very good question. Now, we have all been recommended to wear those face masks generally. Again, not only to protect those around us, but at the same time, as Jesse has a face mask on, then it protects him that if I'm talking and I happen to and have my spray. If we're 6 feet apart, great. If we're not quite 6 feet apart, then he would not be as likely to be able to breathe in those droplets coming from me, and it'd be less likely to be able to get into the body that way. One of the things probably that we all see is the various ways people may choose to wear their face masks. We know that face masks are not the most comfortable. They can feel a little bit stuffy, but again, recognizing what their purpose is so that you know how to use them appropriately. Now, the most famous one that we love to see, we have a face mask on. He technically is wearing it. However, as we're talking and I'm talking or sneezing or coughing, that does nothing for him. His mouth, his nose, they are still wide open. And in fact, all that mask is going to potentially do is get germs on the outside of it that then when he potentially puts that back on appropriately, he could contaminate himself with. Now, the next favorite one we see, and we understand why people want to do this because it's a little bit harder to breathe. Yes, this protects your mouth, but a lot of your air, especially when you are wearing your mask this way, is going through your nose. So therefore you have left 50% of your airways exposed and open. So as we're talking and I accidentally have my spray coming out, Jesse's mouth is protected, but he's still breathing in those droplets into his nose and is exposed just the same. Our nasal areas to down into our mouth and into our lungs are all one big connection. Those are our mucous membranes, and that's how we can be exposed. So it is very important for people to wear their masks appropriately. I think this would be a little self-explanatory from our previous presentation that we did. Nose is protected, our mouth is not. So it's important when you're wearing your face mask, first off, it's important to wear your face mask, especially if you are in public or if you are in any situation where you may not be able to maintain that 6-foot distance from others. And then it's important to wear your face mask appropriately, having the mouth and the nose covered, having it fit fairly snugly against your face and your cheeks, trying to prevent the majority of that airflow going in or going out. Other things that are important with face masks is when you're taking them on or off, do your hand hygiene. Wash your hands for 20 seconds with soap and water, or use your hand sanitizer, and then put your mask on or take your mask off. That way, as your hands come close to your face, you aren't infecting yourself that way. Know that if you're using a fabric mask, that it needs to be laundered regularly and according to the directions for whatever kind of material your mask is made out of. If you're using a surgical mask that is more disposable, once that mask becomes physically soiled or wet, which can occur from our breath, that should be discarded because that breaks down the integrity of that mask. We hope that was helpful for you today. If you have any questions or concerns, please feel free to send them in and we'll do our best to get them answered. Please remember to wear your masks, practice your distancing, and stay home and stay safe and stay healthy out there, everyone. Bye. Bye.